Hello, my name's Daisy Berry, and on behalf of SBK Healthcare, I am delighted to welcome you to this video, which provides an update for healthcare professionals, the latest on COVID-19 vaccinations. We hope that you find this video useful. Please put your thoughts in the comments below, and do remember to like and subscribe so that you don't miss any new content that we upload. It is now my pleasure to introduce you to our webinar leader for today, Mallicka Chakrabarty.
Hello, Daisy.
Hello. Thanks, Mallicka. I'll leave it over to you.
Lovely, thank you. So I'm Mallicka Chakrabarty. I'm a GP in an ex-mining town of Worksop. I'm also a GP trainer, and I have an interest in quality improvement, and I work for the faculty of NHS improvement called Time for Care. So it's my pleasure to be able to discuss with you some recent updates with regards to the COVID vaccine. Thank you all for your interest, your enthusiasm, and your questions and ambitions, which keeps us going. We hosted one of these seminars back in January, which had an overwhelming response and kind of led to generating this webinar. As I say, I am guided by your interests, your expectations and ambitions, and that is what has helped us develop the agenda for today. Today, we intend to cover the latest in the field of COVID vaccines and see where we are currently with the vaccinations. There is a lot of demand to go through the individual vaccination, storage, dosage, transportation, and whatever we need to know regarding that. There is also a lot of requests to understand where are we with the cohorts having the vaccinations, and where do NHS staff stand with regards to their individual vaccines. And finally, some FAQs and some shared learning as we have progressed through the vaccinations. So I will start off with the second agenda first, if that's all right, where we start with a guide to the vaccinations. So 3 vaccines licensed in the UK now. The first one was the Pfizer-BioNTech, followed by the AstraZeneca, and then very soon to follow that was the Moderna vaccine. There are some other vaccines which are in different stages of development, and obviously because they are still going through phase 3 clinical trials, they're not yet in the market, but will be there soon. I'll go through the first one, which is the Pfizer-BioNTech vaccine. Now, these slides can be quite busy. They do have a lot of material, and I can understand it might not be easy to grasp all of this. So I will whiz through them, but you will have access to the slides, and the link to these information is enclosed towards the reference slides. So the Pfizer-BioNTech vaccine is actually an mRNA concentrate. The vaccine itself is off-white in color. The dose contains about, sorry, I'm just going to move my slides in a way they don't interfere with the slides. Yeah, better. So the vials come in such that each vial allows 6 doses of the vaccine to be administered. And the indication of this is clearly prevention from COVID-19, and it is licensed for use in 16 years and older. And this is important because then other vaccines are slightly different when it comes to the age group, very slightly, not major. So what is the nature or composition of this, of the pack? So the pack actually is available as 6 doses, as I say. It comes as a clear vial, which is a glass top, and on the top of that is a stopper. And on the top of that is a flip of plastic, plastic with aluminum shield. There are 195 vials in one batch. Composition, I'm not going to go through each of these, but the whole idea of showing this slide to you is those of us who are familiar with chemistry and biochemical substances know that these substances are pretty commonly used. And this is also to allay the fear that there is no animal product or eggs in these vaccines. Storage, lots of information on the slide, but as I said, we will try and capture the snapshots, and the snapshot really is really cold for temperature. So in the freezer is -80 to -60. If we have it in a thermal container, we are looking at -90 to -60. There is a need to protect it from direct light. Now, once it has been removed from the freezer, it can be stored up to 5 days between the temperatures of 2 to 8 degrees centigrade, and then up to 2 hours at a temperature of up to 25 degrees centigrade. During this time, it's expected to minimize exposure to light, that sunlight and ultraviolet light, but the room light under which it will be operated, it's absolutely fine. Once it is diluted, the vaccines are to be stored or used in a temperature between 2 and 25 degrees centigrade, and use it as soon as practically possible, but no longer than 6 hours. There's no preservative. Once the dilution time has been indicated on the vial and 6 hours are gone, then there is no potential of using these vials. Once thawed, these vaccines should not be freezed again. Preparation, so it's a multi-dose vial. It's stored in frozen and then thawed. We were talking about the temperatures being between 2 and 8 degrees centigrade, and then another 20 up to 25 degrees centigrade for a maximum of 2 hours. The important thing here is really the 2 to 8 degrees centigrade exposure is only for 5 days or 120 hours. And that includes the transportation time from the supplier to the vaccination site, practice PCN, or whatever you might call it. So that reduces the amount of time the vaccine is available to be administered. So effectively, a day and a half for transportation makes it 3.5 days of vaccine time. And that's clearly how the planning of these vaccine sessions will need to be accounted for once we know the delivery time. Additional 2 hours once it's taken out of the freezer up to 25 degrees centigrade. But then when they are thawed at room temperature, then there is an advice to invert the vials up to 10 times. So it clearly says don't shake, but invert. Prior to dilution, the thawed dispersion will be seen as a white or off-white opaque particles. The diluent used here is 1.8 mils of sodium chloride, NaCl, and usually recommend is a 21 gauge needle. Now, sodium chloride should not contain any preservative, and the diluent does not come in with the vaccine pack. So those of us who do injections or procedures would know that there is an air trapped in the vials. So when we are trying to use a diluent, we need to take off some airlock, and the recommended amount of air they're saying we need to take out here is 1.8 mils. So that is similar to the amount volume of the diluent. And then after that, again, 10 times a rocking movement to kind of do it up and down, but not shaking it. Now the color of the solution changes to about an off-white solution. There should be no particles visible. If there are particles, that should be discarded. The time duration that this should be used is 6 hours once it's been diluted, and the temperature range is 2 to 25 degrees centigrade. Each dose is about 0.3 mils. So technically, after a diluent of 1.8 mils, there are about 6 doses which can be administered. Now, the recommendation is to use what is called the low dead volume syringes. What that means is this will help us extract the maximum amount of the vaccine from each vial. 0.3 mils given intramuscularly, recommended is the deltoid muscle. Doesn't matter left or right arm, that's an individual preference. Most vials give 5 doses anyway. With careful withdrawal of the medications, we can definitely generate the 6th dose, but there is no advice to pool in the 6th dose from combining the vaccine from different vials. And similarly, the vaccine cannot be administered by any other route, which is intravascular, subcutaneous, or intradermal. To improve the traceability, so which person and what vaccine they received, each person vaccinated is given a card which has their name, the name of the vaccine they've been given, and the batch number and the lot number. Now, the recommended dose from the manufacturer is 2 doses, 0.3 mils each, to be given at least 3 to 4 weeks apart. Now, that's not what's happening in the UK, but we are here focusing on the manufacturer's advice. Now, there is no data to say that there is interchangeability of the COVID vaccine. So if the first dose has been a Pfizer-BioNTech, the second dose should also be the same. The maximum protection comes in only 7 days after the second dose, although after the first dose, there is between 70 and 90% protection. Caution, obviously, we mentioned that once it's diluted, 6 hours, and then it's not used. So there is a massive emphasis on avoiding wastage. And the big thing here is about transportation. So after dilution, there is an advice not to transport this. And you can see this seriously limits how this vaccine could be used in housebound residents or in care home residents. Few recommendations like what should be followed, what happens. So something that is followed with most vaccine is if they have an acute febrile illness, then best not to administer the vaccine then. If they've had COVID infection itself, then recommended is at least 7 to 10 days before they are vaccinated. Individuals who receive anticoagulant therapy, there's clearly a risk of bleeding and having an hematoma. So the most important thing is to counsel them, and this does not need any extra time. It can be just done prior to the vaccination. It's important to know subjects who are on immunosuppression, and they might have a diminished immune response. So it's just important to kind of explain that right from the start. And as with any vaccine, the manufacturer does have a disclaimer to say not 100% protection. So there is a small number of people who would have the vaccine and still get some form of morbidity from the infection itself. Hypersensitivity is one of the biggest reported problems with the Pfizer biotech. So there is clearly a need to have treatment and supervision for appropriate resuscitation and anaphylactic reaction management at the site where the vaccine is being administered. And therefore, with the COVID vaccine from Pfizer, there is also a recommendation that for 15 minutes after the vaccine, there is need to observe them. The second dose obviously should not be given to anybody who's had a reaction from the first dose of the Pfizer BioNTech vaccine. In certain conditions, where do we stand with using the Pfizer vaccine? So in pregnancy, limited experience, clearly we would know that. But from animal studies, we are not aware any direct or indirect harm or in relation to pregnancy or embryo or fetal development or postnatal development. The administration can be considered if the lady who is pregnant is more at risk from COVID than from obviously the vaccine itself. And these discussions need to happen before the vaccination to explain that the benefits of the vaccine clearly outweighs the risks. Breastfeeding, we do not have enough evidence to say it's excreted in breast milk. Similarly, in fertility, the impact on fertility is a big question that come up with young females who are employed in the care sector. And so far from the animal studies, we are not aware of any indirect harmful effects of the vaccine. It is safe to use this vaccine in above 16. It is not, there have not been enough studies done in under 16 to try the vaccine. In terms of adverse effects, it's not hugely different to many vaccines that we expect. Pain at the injection site, fatigue, tiredness, headache, myalgia, chills, feeling of an arthalgia, a temperature. And the intensity of these symptoms can vary between mild to moderate, and it should resolve a few days after the vaccination. Taking medications like paracetamol or an antipyretic is absolutely fine to help with these symptoms. Now, as such, driving or using a machinery is not contraindicated after the vaccine, but if the above symptoms that we talked about cause the person to not function properly, and therefore they impair their full ability to concentrate when driving or operating a machinery, then it's best to obviously stay away from it. During the study phase with the Pfizer biotech, there's been a few cases of acute facial nerve palsy or paralysis. And in the first case, it was after the first dose on day 37. And obviously this participant did not receive the second dose. But the other 3 cases were actually on very variable days, that is day 3, day 9, and day 48 after the second dose. But there is again no clear indication to say that this might be a reason not to administer the vaccine, and hasn't actually been reported when the vaccines have actually been administered in day-to-day life. So how does this operate? So we know that it is the messenger RNA, which is actually modified and formulated in what we call the lipid nanoparticles, that then delivers this mRNA into the host cells. That will allow the expression of this COVID-19 antigen. And the host cell then elicits both neutralizing antibody and also cellular immune response to the spike antigen, which is so typical of the COVID virus. And then it contributes to protection against the disease. Efficacy. Phase 3 studies have demonstrated that efficacy is 95% after 2 doses. And there is consistently the similar efficacy for different age, gender, and racial and ethnic groups. And the efficacy in those above 65 is about 94%. So pretty good as a starting vaccine. So we move on to the second vaccine, which is AstraZeneca Oxford vaccine. Now, this is a recombinant vaccine, and it comes in a colorless to light brown, clear to slightly opaque, particle-free solution. We know that the recombinant vaccine, it means that it's actually a attenuated adenovirus, which is actually grown in the chimpanzee, which is actually carries the SARS-CoV and spike glycoprotein into the host cells. The indication for this is obviously protection from the COVID-19 individual virus in individuals who are more than 18 years. This is a difference. So Pfizer is 16 and above, and AstraZeneca vaccine is 18 and above. Method of administration, it is an intramuscular injection again into the deltoid muscle of any side. So we can either have a 5 ml vial, which gives 10 dose, or a 4 ml vial, which is 8 dose. I think the 5 ml vial is more commonly available, so it's the 10 dose. And again, with very careful withdrawal practices, and PCN have been able to extract 11th dose of this, which is remarkable, but just increases the vaccination numbers by 10%. Composition. I will not read this out, but again, commonly known chemicals, nothing exotic about them, nothing suspicious, nothing that should have major untoward reactions. Storage. So the unopened vial is stored in a refrigerator between 2 and 8 degrees. It's not to be frozen. And the vial packets are to be protected from direct sunlight. So once it is for use, then it should be used within 6 hours when exposed to temperatures between 2 and 25 degrees centigrade. So we talked about this intramuscular injection. We normally recommend the 1 ml, normal recommendation is the 1 ml syringe with either a 23 gauge or 25 gauge needle. Depending on the size of the individual and the BMI, you can change the gauge of the needle or the length of the needle to the 38 millimeter needles. And these can be used to draw up the vaccine. Again, traceability, each individual vaccinated carries a vaccine card to say they have received the Oxford AstraZeneca vaccine, batch number, lot number, and whether it's the first vaccine or the second vaccine. And this is clearly recorded on the patient's notes, but also a card handed over to the patients. So in terms of the regime, it is usually 2 doses, each of 0.5 mils. And the recommendation here is the second dose should be between 4 and 12 weeks apart. So what is happening in the UK probably follows the licensed indication according to the manufacturers. Again, it is recommended that individuals who receive the first dose of AstraZeneca should have the same vaccine. There is no scope of interchangeability. Recommendations pretty similar. If they have an acute and febrile illness, best not to vaccinate, but cough, cold, low-grade symptoms, it's absolutely fine. Knowledge about whether they have got any anticoagulants, if they have thrombocytopenia is important, so we can discuss and counsel with them about the potential for a hematoma, bruising that might occur after the injection. Again, similarly with immunocompromised individuals, whether they are on therapy or whether they have a condition, it's important to explain to them that their response may be suboptimal. Hypersensitivity, like with all vaccines, it is recommended that there should be medical advice and help available, supervision available, and also resuscitation equipment available at the site of the vaccine. Covering the different subgroups in pregnancy, breastfeeding, lactation, and fertility, really not much different from the Pfizer vaccine, very limited experience again, which is understandable. And animal studies have not shown any direct or indirect harmful effects during pregnancy or in the postnatal period. Administration of the COVID vaccine in pregnancy, again, should consider what is the risks, what are the benefits, and are the benefits worth taking the risks. It's not known whether it's excreted in breast milk, and again, we do not have any evidence from the animal studies to say that fertility could be impacted. With the AstraZeneca vaccine, the efficacy and the safety data in individuals more than 65 years of age is limited. It doesn't say that it should not be used, the evidence is limited, but it's very clear that they don't need any dose adjustments. And we talked about the pediatric population. So the age group here is 18 plus, so there is no evidence of the safety and efficacy in under 18. Adverse effect, not very different to the Pfizer vaccine, but it's mostly, again, pain at the injection site, headache, myalgia, fatigue, malaise, temperature, pyrexia, chills, nausea, and arthralgia. Most of them are mild to moderate in severity and should resolve within a few days. By 7 days, the incidence of subjects with at least one or more of these local symptoms should be between 4 and 13% respectively. When compared to the first dose, adverse effect after the second dose was milder. And it's not been reported to have any adverse effect on driving or the use of machinery. But again, as we mentioned before, if the symptoms are disabling, then it's best to avoid these activities. Mode of action, we discussed this before. So it's a monovalent vaccine. It's a recombinant vaccine. And it is the adenovirus, which is used as a vector. The adenovirus is attenuated, so it's not pathogenic for human beings. And this vector is encoded with the S-glycoprotein found on the SARS-CoV virus. And following the administration of the glycoprotein, it stimulates neutralizing antibody and cellular immune responses. Efficacy, so in the clinical trials, about 11,000 patients in the phase 3 study overall were analyzed, and the efficacy of the vaccine is said to be about 70.4%. So looking at the two major vaccines which are in use currently, there are some very clear differences which dictate how they are used. There's a difference of the storage. There's difference with their ability for being transported, how they're prepared. The Pfizer vaccine seems what I call fiddly, whereas the AstraZeneca is simple, comes in a vial, no dilution, and you can keep in aspirating about, say, 10 doses from a vial without difficulty. The risk of hypersensitivity in Pfizer vaccine obviously limits its use in anybody who had a severe anaphylactic reaction and carry an EpiPen. And the need for observation after the first dose in subjects who received the Pfizer vaccine. So, and these things limit the use of the Pfizer vaccine. And you can clearly see the AstraZeneca is easy to transport. You can take vials out to a care home, to homebound residents, administer them as long as they are up to 25-degree temperature exposure and use within 6 hours. We are minimizing wastage. Okay, and it's worth talking about the Moderna vaccine. Has been approved in the UK, and the UK has secured a total dose of about 17 million vaccines. There is a discussion about starting this from spring. So it's not currently in use, and therefore the detailed information which I could provide on the other vaccines is still not available. 94% effective in preventing the disease, and this includes the elderly. So comparable to that of the Pfizer vaccine. So where are we now? What's happened so far? 9.2 million people across the UK have now been vaccinated, and that's from yesterday. Last weekend, there is a belief that about 1 in 60 people in the UK were vaccinated. And this now includes 9 out of 10 people in the over 80s group, and almost half of the people in their 70s have been vaccinated. All eligible care home residents and staff in England have been offered the vaccine. So that's pretty encouraging, and especially encouraging when we hear about the number of COVID deaths reaching 100,000. So this is a slide that I've shared before. It is a slide from the Joint Vaccine Committee on Vaccines and Immunizations. And they had recommended how we decide on the priority groups. So when the vaccines were first available in the market, Pfizer vaccine, the first target population was above 80. And you can see why we have kind of jumped the queue, because the Pfizer vaccine had the limitation with transportation, and it could not be transported once diluted. So those above 80 who were able to come to vaccination center, frontline healthcare workers, social care workers were the first ones to receive the vaccine. And therefore, soon after followed the Oxford AstraZeneca vaccine, and this led to a large number of care home residents, older adults, and their carers, who are also the social care workers now, who could have the vaccine administered in their premises. Most places kind of have completed that and are now doing the over 70. So when I say that, I mean the 75 and over have also been done, and they are now covering the 70 to 75 cohort, and also what is called the clinically extremely vulnerable individuals. So these are individuals who would need to shield. But obviously they have to fall in the age group, so they should be above the age of 16 years. So we've still got a long way to go before we vaccinate categories between 5 and 9. Latest development in terms of vaccines is the vaccination centers. So there is a list of vaccination centers, and this gets updated every Friday. This shows the vaccination sites that are open across the country, and they are trying to see that the population of 97% doesn't have to travel more than 10 miles to receive the vaccine. And currently there are about 1,400 vaccination sites. The list is only the name of the vaccination site, does not provide any access to their address, or does not provide any contact details. So there's a massive emphasis that people do not contact the center, people do not contact the practice. These organizations will send out letters, and once you have booked the appointment, the rest of the details are made available. What else is happening? Free bus rides, at least in Nottinghamshire, in places like Hull, there is now a free bus ride possible, and these are for, say, off-peak times, like before 9:30, where people can actually go to a vaccination center and not have to think about the transport charges. So that's really made things convenient. Vaccine bus. So this is a project in Surrey, led by a GP federation. Essentially, it's like a mobile vaccine center, but that still doesn't make it like a flu fair or drop-in center. It is by appointments only, by invitation only. And as far as I remember, they did it close to a temple, which was again kind of massively increased their uptake. Involving the faith leaders in removing any misunderstandings or misconceptions about the vaccine. And this has been been undertaken throughout the country. And one of the most impressive ones I came across was this volunteering interfaith program in Bradford, where leaders joining from various different communities were actually talking to people to encourage them to go for the vaccine and explaining there was no biological or animal products there to that doesn't agree with their religious beliefs and faith. Popup Vaccination at a mosque in Sheffield. This is a friend of mine that I am quite close to, and she mentioned this, and she is the CD of a PCN in Sheffield, and basically they opened up this pop-up center at a mosque, and that has allowed people over 70 and those who are shielding, so vulnerable adults, and even some healthcare and social care workers to come in and have the vaccines. And till Sunday, they had done about 100 vaccines in this pop-up center. Again, really impressive. Once it's done in a religious place, it people buy into it more, and the hesitations and the reluctance about the vaccine uptake is much minimized. Massive publicity on the social media. There are now multilingual videos which are talking about the misunderstanding, misinformation about the vaccines. There are radio broadcasts by important people who might be addressing the concerns of their particular community. So absolutely massive propaganda about people going for the vaccine, encouraging the uptake. And we can all see the results of that. Okay. I've tried to formulate some questions and go through some of the answers. So the first important thing is it does not contain any animal products or egg. There's no evidence so far to say it's unsafe to use in pregnancy, and but more evidence is needed before it's routinely rolled out. The advice from the Joint Committee of Vaccines and Immunizations is that if there is a high risk of getting coronavirus where you work, so care industry, or if there is a health condition, which means that the infection could potentially be serious, then there's clearly a benefit of taking the vaccine even during pregnancy. The other ones are vaccine administered in breastfeeding. When people are thinking about conceiving, then they can definitely have the vaccine. There is no need to avoid pregnancy after the vaccination, and there is no known side effect of the virus being transmitted to the unborn child if vaccinated before pregnancy. Phase 1 clinical trials for Moderna, talking about how long is the immunity provided. So Moderna provides the first trials to say, results to say, actually the neutralizing antibodies could be there for 4 months, and thereafter the titers will drop. But we don't still have enough information, considering how quickly these things have all happened. We don't have enough information to say if we actually need a booster. But yes, up to 4 months, there is definitely likely to be some sort of a protection. The fear about introduction of toxins into the body, the fear about this is not a natural way of getting immunity, any kind of conspiracy theory, either by the government or the pharmaceutical industry, it can be a deterrent in accepting the vaccines, and clearly through messages which are graphics, videos, examples of social media posts, there's plenty of publicity that's needed to support the vaccination. So I'm going to tell you my story, and I think I have enough time for that. So this is my parents, my mom and dad. My dad's 80 and my mom is 76. I'm going back 18 months back now. They decided to visit me and my daughter. And there we were, October 2019. Yes, grand welcome to grandparents, and we had a good Christmas. 2020, there is time for them to go home. And come the week starting 23rd of March, lockdown hits, flights are grounded, and my parents are still stranded here. It's been a difficult year for everybody. More difficult when you're not in your own house, when you're not in your surroundings, when your life is tied in a suitcase. It was difficult for me because being an actively practicing GP, I was conscious of bringing home infections. And my daughter, I blame her for any infection she brings into the household. I just honestly believe they share infections. And I therefore felt more responsible for having to protect my parents against just both of us and kind of minimizing transmission of infection in the family. Their world suddenly shrinked. Their world was within the house and maximum up to the garden. And that's what it is. You've got to look at safety, and we learn to compromise with that like everybody else. And then, like, I look at how they have changed their conceptions about photography. They used to use a Kodak camera, and now they're talking about selfies. I think they have adapted the vaccine pretty much in the same stride. So both my parents have now been vaccinated. My dad, obviously being 80, he was offered the Pfizer when it was rolled out first. But by the time my mom had her vaccine, it was the Pfizer vaccine available. So I've got experience of both of them having one each. And the way I look at it is our life is no different now, but I think they have kind of moved a step forward in terms of an immunity passport when it comes to taking a long haul flight to their return back into India, and also minimizing the risk of an infection when they're up on their own again, and also minimizing the need to quarantine, hopefully, depends on how rules change. So I thought I will include this information. So what actually happens when you go for your vaccine? What happens at the site? You should be able to see marshals in their fluorescent jackets signposting you to suitable car parking spaces, because they kind of have an idea of what time your appointment is, and they direct you to places which are likely to be cleared first or last. They then check if you need any access support, so wheelchair or any support to walk up to the center. And obviously people can forget to bring their masks, so they have additional masks which they are able to provide. Once you go into the appointment center, they check the ID, they check that there is no COVID symptoms, they check that there's been no infections in the last 7 days. They also ask about the flu vaccine not being in the last 7 days. They find out if you've not been a participant at a trial, because clearly that means that you might have had one or both the doses. If you can find out after being unblinded. They find out about immunosuppressants and anticoagulants, and then they proceed to the vaccinator. At the site or at the table of vaccinator, there is a pharmacist usually who is drawing up, because they can meticulously calculate the dose of the vaccine and make sure that each vial, each ampule is used 100%. And then there is somebody to do the admin work or documentation on the patient records and also on the system called Pinnacle. And finally, there's the vaccinator who asks which arm to vaccinate and vaccinates the individual and gives them their card. With the first dose of Pfizer COVID vaccine, there is a waiting time of 15 minutes. So there is a socially distanced waiting area and then an exit. Obviously, with the Oxford AstraZeneca, there's no need to observe them. So they can immediately leave through the exit door. And I included this slide quite last, but I think the vaccines are definitely a ray of hope. We can see light at the end of the tunnel. But for now, we have got to contend with socially distancing and also face masks. What have we learned? What is the shared learning from this? Nothing explains this as beautifully as Becky Bird's Twitter feeds. And what she says is proud nurses, doctors, pharmacists, paramedics, healthcare assistants, administrators, volunteers, managers, running the COVID vaccine clinics and delivering vaccines to the care home. Some of the sites are NHS, but because of the scale at which things are happening, leisure centers, cathedrals, parish halls, football grounds are all turning into a vaccination center. Everybody from the local authority to parish councils have helped manage venue, clear the roads, and also help with car park, snow management, etc. Clinical commissioning groups and commissioning support units have provided the back office support and staff, but equally important are the humongous, massive number of volunteers who are in operation to enable this vaccine to be rolled out. The retired health professionals who are coming back to work as vaccinators, but also car park marshals, meters and greeters, drivers, and clinical administrators, without which this massive campaign couldn't have happened. These are some of my references that I have used to collect the material for this presentation. And now I am available to answer any questions.
Thank you so much, Mallicka. That was a really interesting presentation. We
you.
have got a lot of questions coming in to the Q&A, so I'll start reading some out to you. So the first one is, if the Pfizer studies show that efficacy is proven after the second dose is given a few weeks after the first, however, as you've already stated, this has not been the case within the UK, with the second dose being given 12 weeks after the first dose. What does the clinical studies show on dosing the vaccine in this way in terms of efficacy and safety?
Sure. So what we are here in a simple language asking is, what is the efficacy of the vaccine after first dose? Variable, but not low. So between 70 and 90%. And we can see the idea of the government, why they have taken this approach. The idea was to vaccinate larger number of people and then actually vaccinate a small number of people and increase the efficacy. Having said that, in England, people are, that you will find a variable amount of people. So you can find an above 80 who's had both the vaccines, you can find an above 80 who's had one vaccine, and you can find an above 80 who's had not been offered anything yet. So it is very variable.
Thank you. So another question here, there are more mutations happening. How will the available vaccines cover these?
Okay, so it's hard, it's difficult, and we don't know exactly yet what is happening, but the mutations are likely to affect 1%, not more than 2% of the vaccine structure or the genetic makeup, or sorry, not the vaccine, I meant the genetic makeup of the virus. So if the virus, mutant virus, is 98 to 99% similar to the COVID vaccine, we expect most of these vaccines to work. Having said that, there is still no proven evidence that they are going to be effective, but the theory in principle is they are likely to be effective.
Thank you. If AstraZeneca vial is taken out of the fridge for 2 hours but unopened, can we keep it back in the fridge to use it later?
Yeah, so it should not be frozen, but as long as it is kept within the temperatures of 2 to 25 degrees, that's fine.
Thank you. For cancer patients who are on active chemotherapy treatment, when is the best time to administer the vaccine, especially those who have day 1, 8, and 15 treatment? Thanks.
The patients I came across, they were having it slightly more spaced out, and they were being asked to have the vaccine just before their second dose. So probably we're looking at between day 6, day 7, if they're on the 1, 8, and 15 dose regime. So yeah, before the second dose.
Thank you. Is there any information about whether side effects are likely to be greater or milder after the second dose compared to the first? Likewise, the risk of anaphylaxis.
So the risk of anaphylaxis is more in the first dose, and similar, the risk of side effects of any nature, whether mild, moderate, or severe, are always likely to be after the first dose.
Brilliant. What is the rationale for not giving to 16 to 18-year-olds?
One is we expect most of these people to be healthy. Obviously, having said that, they can have children with asthma who've needed high dependency unit and are under the shielding register, but it's just not enough studies being done in these age groups. Who knows that some of the new vaccines, maybe the Johnson one, will have a slightly different age group.
Thank you. Does the origin of the vaccines have different outcomes, i.e. Pfizer using RNA and AstraZeneca relying on antibodies?
I think we have, it's really short. They've all been developed since about, say, end of summertime, and they are in the market. Obviously, the process for regulating them has all happened very quickly. I don't think we have enough evidence to comment on this. If you look at their efficacy, they can be variable, especially the AstraZeneca, where not much trial has been done in the elderly population. But generally, they should provide a baseline herd immunity enough to actually prevent severe form of COVID, even if it is symptomatic.
Brilliant. So I've got another question here. Can you remind us of the actual endpoints? Am I right in understanding that the Pfizer one protects people from severe illness, but little data on transferability or contracted virus, but that AZ showed also reduction in infection rate.
So both the vaccines do not stop us from getting the coronavirus. So we can still contract the virus and we can all be carriers after the vaccine. What the vaccine stops is the inflammatory response that follows following an infection, and the severity of that response is reduced. So how the body reacts to the virus is different after the vaccine.
Which vaccine is better for diabetic? So HCP and cardiac patients plus high BMI.
If they have not had any allergic reaction and if they do not carry an EpiPen, they can have the Pfizer vaccine. But it also depends on, are they homebound? Can they actually come to a vaccination site? And are they on the shielding vulnerable register, which means they'll be having their vaccines more quicker. So they can actually have either, but they can't choose, sadly.
Thank you. When considering the training and education of non-registrants, how is this staff group's competency being measured? Keen to hear what others are doing for this group.
Okay, so we covered this partly in our first webinar where we talked about staff training, looking at resuscitation skills in everybody, looking at the vaccines assessments and the vaccines modules from e-learning for health being done in all clinicians who were participating in this in these clinics. And also obviously making sure that they all know, especially the marshals who are volunteering, they have a confidentiality arrangement with regards to data protection. So there is actually lots of groundwork that goes in even before the clinics are set up.
Thank you. We've got lots more questions coming in. Once vaccinated, can you pass the virus on to others?
Absolutely. You can still be a carrier. You will not develop the symptoms of the vaccine, but you can be a carrier.
Thank you. Do you know if there are plans to vaccinate under 50s too?
Absolutely. So if they have a medical condition, yes. And there might be after, it's not quite included in the 9 categories, but yes, it might be included afterwards, but there is nothing concrete yet.
Can the AstraZeneca vaccine be drawn up at a GP clinic and then transported to a patient's home to be administered, or does it need to be drawn up where it is being administered?
It is technically easier to carry to the care home and then withdrawn from the vial there and administered. If you think of it, you have to carry 10 insulin syringe loaded with 0.5 ml of vaccine. That is a lot to carry. So it's much easier to carry the vials and also minimize needle stick injury.
How long after being a close contact should you get a vaccine as a healthcare worker, had symptoms but tested negative?
I'd probably say the recommended 10 days. So that is 10 days of what is your isolation period. And after that, so between 7 and 10 days, you should be able to have a vaccine.
Brilliant. So there are a number of staff in my organisation who have decided not to have the vaccine. Can you recommend any resources we can use to persuade them?
So I think we have got to adopt what is an individual bespoke tailored model for that individual. What is their concern? I was speaking to somebody who is a young social care worker, works in a care home, and she clearly did not want the vaccine in the fear of impact on fertility. But then it came to her job being threatened, and rightly so, because she was now at risk of having the infection when everybody else in the care home, including residents, had been vaccinated. And that just completely, more than convinced by the doctors, the fact that it actually impacted her earnings, made her change their mind. So it's understanding what is their belief, why did they not want it.
So if you are given an opportunity to choose your COVID-19 vaccine, which one will you pick and why?
I was more tempted to say that I would choose the AstraZeneca, but actually it doesn't matter. I had the Pfizer COVID vaccine myself, and I think it's just the question of which one is available earliest rather than which vaccine to choose.
Thank you. So we've got another one here. Please can you clarify about the information you gave about anaphylaxis? You said the vaccine shouldn't be given if patients have a history of anaphylaxis and carry an EpiPen. My understanding is that this is if they have a history specifically of reaction to the vaccine, first dose, or any components of the vaccines in the past. In the clinic I have done, there were lots of questions about anaphylaxis reactions to bee stings, etc. As far as I know, this is not a contraindication.
So if they've had any form of a massive anaphylactic reaction before, which has led them to then carry an EpiPen, whether that is bee sting, nut allergy, it's best to avoid the Pfizer vaccination in them. If it is somebody who is allergic to say 20 medications and the coating of the medications or the color of the medications, but they have not had any anaphylactic reactions, it's fine to go ahead. So it should, because with the first dose, you have to look at it a bit broadly. When it was administered on the second day, which is the 8th of December, or 9th of December, the major reactions were in those who had a background of previous anaphylactic reactions.
So should a female looking to get pregnant have the vaccine, which one would be safer?
So either of them, the evidence with both of them is very similar. It's animal studies in both, and there is no reported impact on fertility.
So this question is quite similar. Is there any evidence of the Pfizer vaccine affecting fertility?
So as we said, there are no long-term studies, no human studies. There is animal studies, which obviously say there is no adverse effect on the fertility from the animal studies.
Thank you. If someone has a severe reaction and an adverse injury from the vaccine, how is this data collected?
So there is what is called the MRHA yellow card system, and you should be able to do it through Google Play. But the manufacturer has their own way of reporting adverse effect, and either of them, as long as it's reported, is fine.
Thank you. So what is the effect of the vaccine on children on methotrexate injections, please?
Methotrexate injections, yeah. So no, that's okay. So we talked here when we're talking about children. So the Pfizer vaccine is only 16 and above. The AstraZeneca is 18 and above. So impact of methotrexate means they are on an immunosuppression, and they will not have the optimal immune response. So they will not generate the antibodies as like an individual who is not on methotrexate. But again, the best thing you can do is they will probably benefit from it and counsel and administer the medication properly just before the methotrexate dose is due, so that at least their immunity is their best at that stage.
So we've got another one here. My question earlier about transporting the AZ vaccine was for if it is to a housebound patient, so it would be delivering one vaccine. Could this be drawn up from the vial at the GP surgery and then taken to the patient's home?
There is no reason why this could not be done, but you've then got to, so with all the vaccines, there's a clear instruction from the time it's been exposed or opened for use to label the time, and it has to be used within 6 hours of the time, and the temperature maintained at 2 to 25 degrees. If you can do that for all the individual syringes having 0.5 ml and decide how many homebound patients you're likely to inject, that's fine. But that is a much more tedious process than carrying the vials, and also considering, if you consider like when our staff have gone out, they've kind of gone out to one area. They usually 2 people go out because one person documents, the other person draws the vaccine and administers. So it's much more effective use of time if you look at the vaccination, if you look at transporting the vials. But you can always do what is called the plan, do, study, act cycle. So you can have one member of staff doing it this way, one doing the other way, and see which one works better.
Thank you. So during the COVID-19 pandemic, anti-vaccination activists identified MRC5 as an ingredient of the COVID-19 vaccine AZD1222. The fetal cell line used in the manufacturing of AZD1222 is HEK293 through the cells are filtered out of the final product. And that's more of a comment. I don't know if you've got anything to say on that, Mallicka.
I think it is relating to the second question we parked for answering later. So if you remember, we were talking about using attenuated adenoviruses, which have been cultured in human embryonic cells. So that is just kind of being said that it is then having an animal product, but actually the viruses were grown in embryonic cells, so that is not actually a component of the vaccine.
Thank you. Fertility aside, would the vaccine affect the unborn child?
No. So we mentioned this before, that if a lady decides to have the vaccine and then subsequently gets pregnant, there is no evidence of any adverse effect on the fetus or in the postnatal period, but there's also no evidence of transmission of the virus to the fetus.
So an interesting one here. Social media is playing a negative part on the vaccines, providing false facts. How could this be tackled?
It depends on which social media you're looking at and what is happening. I mean, I have only heard positive feedbacks through the social media, and obviously probably a light-hearted banter saying if you don't have a photograph when you have been vaccinated, it's not as effective. But I am really yet to come across any negative publicity about the vaccines.
Thank you. So many healthy people who have had COVID do not have severe symptoms. Is there any advantage to have vaccine with you with a healthy immune system?
So there is no guarantee that they will always have a healthy immune system. We don't know what the future holds for us. We don't know what would affect this individual's health in future. So it's probably best to do something to protect it from an infection when the vaccine is easily available and free of charge.
So any ethical vaccines on the horizon, not connected to cell lines HEK293, harvested from human embryonic kidneys?
So as I said, the information about these vaccines become much more available once they are MHRA approved. And at the moment, the detailed information is only available for the Pfizer and the AstraZeneca vaccines.
Brilliant, thank you. Is there any truth in a person who has had COVID experiencing more side effects?
No, not at all.
Thank you. Have there been any fatalities post-vaccine?
So luckily not so far. As I say, day 2 of the Pfizer vaccine rollout in early December, there were reports of anaphylaxis, but no fatalities so far.
Thank you. So I think that's all we've got time for today. So just to close, I'd like to thank you so much for your time. And I'd also like to thank the attendees for all of their time in joining today's webinar.